If you are a person who is struggling with your OET speaking module, then I'm quite sure that you're not into English language in your daily life. In such situation, what we can resort to is exam-oriented training. Why I recommend exam-oriented training is because learning a language in a short period of time is not quite possible. Hello, my name is Prathas. So today I'll be talking about the possibility of learning to speak effectively in an OET speaking subtest in a limited period of time. A person who knows about speaking roleplay card would definitely understand that there are multiple scenarios, different situations presented in OET speaking roleplay card. But again, we can conclude it in certain areas. For example, there will be information that should be imparted from the part of a medical professional or from the hospital, and there are certain measures that the patient should be taken before leaving from the hospital. And there are certain response that the nurse or the medical professional should make sure to make the patient comfortable. And also, we have to make them feel good when you speak. So we'll check that situation and we'll prepare for that. For example, the information that the medical professional should give would start like, we will arrange, the doctor will administer, the doctor will examine, we will be providing. For example, we will be providing the help of physiotherapists and the support of occupational therapists for your easy mobility. The doctor will administer you as a first step, and he'll be planning the discharge management. Or you can say, we'll be providing adequate medication and painkillers when you find severe pain. So these are the certain things that medications or certain advice or certain duties that hospital or the medical professional should do. When it comes to the patient part, there are certain measures that they should take. For example, we can advise a patient to take certain measures. For example, I recommend you to intake of plenty of water. I request you to practice regular exercise. I highly advise you to take the medications properly, and also I suggest you to involve in certain daily healthy daily routines. Include high fiber rich food, nutritious, follow a nutritious diet, certain measures that we can advise the patient. Yes, and another part is the response that a medical professional should give to the patient in order to make the patient comfortable. For example, there are two possible replies that you can expect from a patient when you ask them, how do you feel now? It can be good or bad. If it is good, definitely the medical professional will be happy, and you can say, I'm glad to hear that, or that's great, I'm happy to hear that. If the reply is in the other way, definitely we should empathize with them and say, I'm sorry to hear that, or you're understandably upset and we are here to support and care for you. Yes, and what are the other ways to console a person or make them calm? Try not to worry. We are here to support and care. We have the support of professionals. We have the best professional support. Now let's check in some of the vocabulary that is associated with doctors. If we are talking about the doctor, we can say the doctor would examine, doctor would determine, doctor would check, doctor will give information about. So according to the character in the role play card, we can decide certain vocabulary that is suitable for it. So if you have a very intensive training on the parts that we need to focus, it would be easy even for a person who finds difficulty in speaking. So put your comments and suggestions in the comment box. Keep updating with us. Let's update. Bye-bye.